Hello, everyone. Welcome to Real Talks One podcast. Today's session will be dedicated to the cancer journey of my wife. Technically, today is 1 year anniversary of us finding out that she had cancer. And last update that I did was from US in December when she was getting her uh, final, uh, infusion for Taxol, which was for 12 weeks. Um, and I wanted to, share what we have been going through in India and how she has been progressing. So, just a brief recap that we found out about this breast cancer that has metastasized to the bones, stage 4, which is HER2 positive and ERPR positive, was in late August, almost the same date as we are speaking today. Her chemotherapy began on 19 September 2024. This was post pregnancy. Basically, we had delivered our baby in June 2024. And after 2.5 to 3 months, we detected the cancer, which was already stage 4 and had spread much beyond the breast to lymph nodes and liver and bones and things along those lines. Uh, After taking the first line of treatment that involved Taxol, Pertuzumab, and Transducimab, along with the ovary suppression using Lupron and bone strengthening using Zodonic acid, she demonstrated a remarkable recovery in the cancer journey. All her pains were gone by the time we hit December 2024. She started feeling very good. She was not on any pain medications at that point of time, and she was just doing the targeted therapy that involved monthly dose of ovary suppression and bone strengthening, and every 21 days protocol of pertuzumab and transducimab. So we came to India towards the end of January in 2025, earlier this year, and that was the last time where we took the treatment for cancer. Then in February we stopped all treatment and wanted to switch completely over, uh, alternative, natural therapies, whereby she already was taking beetroot juice, carrot juice, celery juice, and we completely cut down wheat. So we were taking jowar, bajra, ragi, as well as we cut down all dairy and dairy products. So no milk products, etc. And of course, we cut down complete sugar as well. So we already started this from the last year itself, reading about cancer and what foods to eat and what not, and that journey was continuing. And in when we moved back to India in February, she was doing incredibly well, felt very good about herself. We were bringing her down to the park. She was moving by herself, taking along both the kids with her, and in fact, she started doing headstands and things like that also. Mind you, by this time, she had not been operated because her spine surgery was due on 2nd of January. That was basically postponed indefinitely, seeing her condition. They said that you don't need the, spine surgery. You don't need the shape of L3 vertebra body at this point of time. But in case any weakness develops in your leg, or if you have difficulty in any bowel movement or bladder movement, etc., then we can basically think about the surgery. But for now, we are not going to do that. So that's what happened. We basically forgot about it and moved on. Uh, Point is this: later on, from March onwards, actually around 7th of March, she developed very high fever of 104 Fahrenheit, and when we did some testing and all, we figured that this was a thyroid infection, and this basically continued for the next 2.5 to 3 months. So she got thyroid, then she got uh, you know fungal infection of blood. Aspergillus is the right name for that one, and then she also got UTI on top of that as well. So all these, fever with all these infections basically took a toll on our health. And as a result, when we came to India around in January, she was weighing around 51, 52 kgs. By the time she was hospitalized due to so many infections in Fortis at Vasant Kunj in Delhi, Vasant Vihar, actually, there she was measured and she was about 47, 48 kg in early April this year. When she basically checked out from the hospital, came back home, and towards the end of the month, we restarted her targeted therapy of pertuzumab and transduzumab on 8th of May this year. By the time when we took her weight again, she was already 38 kgs by now. So within like 1 or 2 weeks from late April to early May, she lost 10 kg weight right away. So this made her extremely weak. She had difficulty in walking. By this time, she had also developed a lot of pain in the backbone area, in the spine area, and she was not able to lie down on her bed during that time. So she used to always sleep on a like a side, either left side or right side, but not on the back. Um, so those symptoms had started developing. When we did a PET scan in April at Fortes, they were not able to recognize. They were not able to do a differentiation between the PET scan that we took in December last year, and as a result, we were not able to find out exactly whether her cancer has actually progressed or not. So that always remained a mystery, but our oncologist basically suggested that cancer has progressed, basically, and it's better to basically restart her, targeted therapy that she was on. So that's what we did. So on 8th May, she got her first dose again of pertuzumab and transduzumab, and then this continued actually. We did like almost 4 cycles of every 21 days. You have to get one. So we did that. And by the fourth cycle, it seemed that again she was regaining her strength. She was eating well. Her blood work also started coming out to be better. So uh, earlier her hemoglobin had dropped to almost 8. Now it started becoming close to like 9, 9.2. And our liver function tests also were becoming much more normalized. Earlier they were way off actually. So we thought that she's getting better overall. Even her albumin level was also improving by the day. So it seemed like things are kind of moving in the positive direction. In fact, she also started kind of walking, and she suggested that let's start going to the our park that is there in our apartment. So in like July, in fact, she when she started regaining strength and felt good about it. So 3 days we actually went to the park in our society, and after third day, she didn't feel good. She started feeling some pain in her leg, especially in the pelvic area and in the thighs. And I suspect, because she basically sat down on the ground in the park, maybe that impinged her nerve because already her spine was not stabilized, right? L3 had already collapsed. So maybe some nerve impingement happened there or not, I'm not sure, but that's what likely happened. And during the past few months, she had lost a lot of weight. So I'm thinking overall body stability, muscle, all of those things got compromised, which might have resulted in, involvement of her L3, uh, leading to like nerve compression in the spinal canal. I think that is what happened. And as a result, slowly, she started developing a lot of pain in her like pelvic area, legs. She refused to go to downstairs or walk in the home. Also, she had already started like watering plants and uh, moving around in the house. But now she was more confined to the bed. In fact, so to improve her movement, we got her like a walker. So again with walker, she started walking again, but again she had a lot of pain, and Sometimes one or twice she even fell down using the walker as well. And both the times it happened, I was not at home. I was either downstairs or leaving my son at school or something like that. So this concerned me a lot because this was something I had never seen before. This was something new for us, and slowly she stopped walking using the walker as well. She was completely confined to the bed, and even to go for bath and all was a big ordeal actually. So then we decided that we need to urgently take her to the either neuro or radiation oncologist. So we took her to radiation oncologist at Kadkaduma. There is this Deepak Kailash Hospital in Delhi. Um, there they suggested her to go through an MRI before they can do the radiation. And then when she came back for an MRI, she was unable to lie down on her back. She had like super immense pain, and as a result, they suggested to come next day. They will do an anesthesia, and then she can do an MRI. So next day when she did a MRI using anesthesia, uh, her upper half of the body kind of recovered, but both her legs basically stopped functioning after MRI. So we immediately rushed her to the Deepak Kailash Hospital in the emergency. So she stayed there close to like 15 days, and their doctor got confused whether they have to do the spine surgery or they have to do the radiation first. So between this back and forth, we decided let's go for the radiation initially. So she got five fraction radiation for her complete spine, basically exoskeleton of the spine and right pelvic area actually, because this was a large field where the radiation was given. Um, Within like 2 to 3 days of the radiation itself, she started seeing like pain going off. So she no longer had pain in the pelvic or the legs or the back area. So that was good. Secondly, we also saw the movement in her legs started improving. So the toes started moving, her both the like the thighs started moving. She had better control over her legs. Even though that control is not complete, it's still kind of she can feel the legs. She has sensation. Pain is not there, but still she cannot stand on her legs or walk with her legs. That's still not there. But then there were a couple of side effects also that she got, because again the radiation also we took for the first time. We had never taken radiation earlier last year because we were not recommended one, and neither we had done any surgery. So in fact all the doctors here asked us like, why didn't you go for the spine stabilization surgery, etc. So we had to explain everyone that this is what we have got in the US. This was the recommendation and we just went with that. But anyway, apparently it seems like at some point of time we will have to do the spine stabilization, because right now, because she's become so weak, we don't know what other kind of nerve impingement it can do, what other harm it can do. She can sit straight, she can lie down straight right now, but we all understand that L3 is a total collapse, and even there is a slight compression of L1 as well in the spinal canal. So those are the two things that came out in the MRI. Then we did a PET scan for her also in August, and in the PET scan there were two kind of things that came out. So one is it came out that there are no new lesions in the bones. These are all old lesions that were there, and in fact, all of those lesions are healing at the moment. So I think that healing of bones is happening, which is actually pretty good. But then on the other hand, the primary tumor in her left breast is actually slightly increased as compared to April PET scan, and even the lymph node and the adrenal is also slightly increased. So they have documented it as a progression of cancer, even though the bones have actually seemed to have healed. So as a result they asked us to change the treatment. So we were doing pertuzumab and transduzumab every 21 days, and then we were doing like every 3 months we were doing like bone strengthening and ovary suppression. So that remains the same, but rather than pertuzumab, transducimab, now we are going to shift upon TDM1. So TDM1 is kind of like comprises of an active chemo plus targeted therapy, whereas pertuzumab and transducimab was pure play targeted therapy. So we have already gone through one infusion cycle of TDM1, and so far she seems to be doing fine. But then on the other hand, due to the radiation that she went through, she's having a lot of side effects from it. Like she lost control of her bowel. Actually, not her bowel has become like erratic, with lot of diarrhea and loose motions. Every hour or so she has been getting. On top of that, because she had to get a catheter, and because of that she got a UTI as well. So she's on antibiotics as we speak right now. So that has also caused a lot of a problem for her. And then on top of that, she had lost control over her bladder, in the sense that she understands that she is feeling that bladder is full and she wants to pee, but she cannot actually pee. So that's the problem. But luckily for us, around 2 to 3 days back, um, we were trying to do the irrigation of the catheter, because we found out that she has a strong UTI, infection. So while doing that, basically the catheter came out, the balloon popped actually inside her, and as a result, we tried to make her pee. She was able to basically pee. So in a nutshell, it was a big positive that she regained the regained the strength to pee again by herself without needing a catheter. But then, because of the side effects of the radiation, still she poops quite a bit every 1 hour, and due to complications of UTI, again, she's under a fever, and then she's taking a lot of antibiotics. So it's a big problem, because she cannot walk, and also mostly it is all in the diapers. So I mean, I have to change diapers again and again, and be with her, and because of her diarrhea and all, she kind of keeps pooping again and again. So it's kind of messy situation. But thankfully, I think from the last 1 or 2 days, she has been doing fine. But now she has got a viral infection. So I mean, there's just so many things that happen simultaneously, because both my kids are also sick. They both have viral, and both of them are coughing. Thankfully, I am the only one who is not coughing and doesn't seem to have viral. But this is very good, because if I also get one, then who is going to take care of my kids and wife? So that's in one sense it is actually good. But I'm just sharing you what I go through on a daily basis. And I don't I'm not sharing this because I want any sympathy or something like that, but I want to relay the truth that I'm going through, our family is going through this. And cancer is very, very difficult disease to manage, because I have gone through, I don't know, at least 8 or 10 oncologists. um, there is just tons of confusion overall. Nobody knows exactly how the cancer is progressing. So we actually underwent another biopsy, rebiopsy, to figure out what kind of cancer it is. Is it still the same? And even now, it is still HER2 positive, ERPR positive. So the targeted therapy that should be there should still work for her. So now we have moved on to TDM1. We'll see how it goes. As I mentioned, we wanted to try ivermectin and fenbendazole. So we tried it for 2 days, but because of her constant loose motions and fever and all, so she didn't want to take so many medications, because she was just overwhelmed with so many medications that were going on. So we stopped that treatment in between. But once she becomes better, we'll basically restart it again. Now we also took suggestion from couple of neurosurgeons as well, because apparently it seems like that we should have undergone spine stabilization surgery last year itself, when we figured out that her L3 vertebra had a pathological fracture. But that's how the US doctors are. Nobody kind of pushed us to go through it. Otherwise, we would have gone through it. But now many of them are saying that now your health overall, because the weight is only 35 kg, has deteriorated so much that doing an operation right now might be a little bit risky, and you have so many complications with respect to side effects of radiation and things along those lines. None of this was present with her last year, right? This is all new things that have happened only in this year. So there is still long ways to go. One is she has to come out of the UTI, which we think in another week or so she should be coming out of it. She should have better control over her like bowel and urine. I think in 1 or 2 days, I think she's getting better. So I'm thinking it will also self resolve. Next step for us would be will be the spine surgery, because we have to stabilize her entire spine. So that will be next step. Again, last time also we were planning for it on 2nd of January. It didn't happen at that point of time. Again, we are going to plan for it. God knows whether it will happen or not, because as I said, we did a lot of planning, but things don't seem to go as per plan. Things just keep changing all the time. So that is where we are. This is the update about her cancer journey. So technically today marks 1 year of her cancer. This is when we detected her cancer last year, technically end of August, and we are back to the same time again. Last year, towards the end of the last year, we were very hopeful because it seemed the first line of treatment worked for her. She was recovering very well. This year has been very much mixed, I would say. A lot of complications with secondary infections and lot of antibiotics. She lost a lot of weight. Uh, Now she has lost movement of both the legs, so a lot more tough situation right now as compared to last year, and we're still fighting it out. We're hoping that there is some light at the end of the tunnel. We are hoping that maybe we find some good spine surgeons who can basically take her case and do the best that they can to revive her motor function. The good part is that she does seem to have some movement of toes. She has some control over her knees and thighs, and so every day there is slight improvement in her kind of movement of her legs and all. But we want her back to be able to stand back on her feet and be able to walk. That's what we are hoping, and thankfully she is no longer in pain as well. So I think in a week or two, we should be in a situation where we start consulting some spine surgeons again, or neurosurgeons again, to basically start the process of surgery if it's the right thing to do. Right now, even the doctors in our previous hospital, Deepak Kailash, where we were, they also got confused. Initially, they were saying we need to do urgent surgery, and then 15 days later, they said her condition is not such that where we can do the surgery. So there is like kind of back and forth that is going on. So that's all I had today. I am reading Pawan Yadav's question. Stay strong, brother. She'll get well soon. Thank you, Pawan. I know in your family also, I think your dad, you mentioned about cancer, if I recollect correctly. I hope, you're also staying tight and trying to do whatever best you can do. Meanwhile, that's all from my side today. I hope you are enjoying your time. I don't want to overwhelm people with my cancer story and sob story, because that's not my aim. My aim is to motivate people. What I'm trying to tell here is that even with whatever is going on, I still basically do the podcast. I talk with that and keep a strong face. And this is also my time. I think it's okay. Um, I have two young kids. We have been with my wife for close to 11 years now. So this is also a journey in our life. Life is very long, and I hope that once she comes out of it, we'll not even remember this phase, as we had already forgotten what has happened in the US in the second half of the last year. So hopefully even this phase will pass and we'll kind of move forward. Mayank, sir, मुझे पता नहीं था कि you are going through such a struggle. I hope everything goes well. Thank you, Mayank. We all are going through different kind of struggles in our own life, and I don't like to bring this thing, but this is part of my life. So I wanted to share this thing. So this was a upgrade that was due from my side as well, because it's been almost 1 year. A lot of people, it can help a lot of people to see what the journey is and how ups and downs keeps happening, and we all have to try different options. And as I said, right, nobody knows exactly how things are going to play out. Look, as I said, I myself have gone through at least 8 to 10 oncologists, and again, I have mixed reviews about like what one is saying is right, what others is saying is right or not, and things like that. Spine surgeons, I have not gone through multiple of them. I've just started kind of talking to, but I'll keep everyone posted as to what goes through, what happens. Does she show improvement, or cancer progresses, or what turn it takes? But yeah, that's the life of a stage 4, cancer patient with metastatic disease. So the good part is, at least in India, I have a like a full time maid, like at least for 12 hours. She comes in the morning, 7 to 7, takes care of my younger one. My son goes to the school which is nearby, so he's like 6 years. Then I have like cooks who come and basically prepare food in the morning and in the afternoon. So at least those kind of things are available here in India, so that's a big relief. My in-laws are very nearby us. They live in the next tower, so sometimes there is some help that we can get from them. My parents live in Delhi, so in fact, they also spent close to 8 to 10 days with us at our home. Just like last week is when they left. Basically, like I think this Sunday is when they basically left back to their home. So I think in India, because of family availability of different doctors, and accessibility of different options, I think life is slightly easier. I wouldn't have been able to do those things in the US. So at this point of time, at my life stage where I am right now, India seems to be the right choice for now. But again, India has its own troubles and things like that. So it kind of cuts both ways, right? So with that, I'll take your leave for now. Please take care. Have a nice day. If you like this podcast, please like it, share it, subscribe it, so more people can look at it and benefit from it. And if you have any thoughts, any comment, please write it to me.